My name is Bob Erickson. I have the privilege of serving as the president and CEO for the Hospital Sisters of Healthcare system in the Wisconsin market. You all are here today and have been invited so we can share some exciting news. And when I look around the room, you all are connected or interconnected with us in our ministry and our mission. I see frontline staff, I see physicians, I see our elected officials, I see good partners, board members, I see our media who do a great job of telling our story and keeping our community informed. I see philanthropists who've helped support us as we've grown and gone. And we all share something in common. We want great health care in our community. We want a great quality of life, and we care deeply about this community. And that's why we're so excited to share some transformational, exciting news with you today. So thank you for being here. So I'm pleased to announce that HSHS is embarking on its largest investment in history, and it'll be right here in Green Bay. An estimated $270 million of capital will be spent and invested over the next 3 to 5 years to expand and transform HSHS St. Mary's Hospital Medical Center and enhance HSHS St. Vincent Hospital. Now, this is much more than an investment in buildings, bricks and mortar. This is really an investment in our community, for our patients, for our neighbors, for those that trust us with our care, with our physicians, with all of our colleagues who each and every day count on us. This is an investment for them and for our future. This investment also really represents a growing community need, and that's what it's based on. And this community need is something we have been committed to for well over 100 years. So why today? Well, a few things. So Brown County is actually growing. In fact, the Wisconsin Department of Administration considers Brown County one of the fastest growing counties in the state, with the population expected to increase by 12% in the next 25 years. It's a good problem for all of us to have, right? To put that in sort of real numbers, about 11,000 more people in the next 4 years will call Brown, Oconto, Kewaunee, Dorr, and Marinette counties their home. That's a nice growth trajectory for a community, and I think reflects the quality of life that we have. In addition to that growth, as we all know, the demographics are pretty consistent across the country. We're all aging disproportionately as a population, which is good news. People are living longer. The challenge with that is, from a hospital perspective, over time, people get sick. People need a higher level of care. There's more chronic disease. And that's why we need to be here and expand looking forward. The third component is also a really good thing for the Green Bay area, is we have seen over the last few years a really expanding geography from where patients are coming from into a higher level of care in Green Bay. And that's not atypical. Our bigger hospitals are more prepared and for specialty care. And again, these dynamics of growth and an aging population, we're seeing patients generate from just a wider and wider geography. And we're seeing that each and every day, people coming into Green Bay for care. So ultimately, we need more space to take care of that population, that growing population. We need more space that can handle higher acuity care, sicker patients, more procedural type care. And that's what we're going to be investing in going forward. So the largest portion of our investment to start with will be right here at the St. Mary's campus. We'll begin this spring, summer. And today we're pleased to be able to share some further details with you on that and the transformation that we envision and the impact we believe it'll have in our community. So to get into some of the specifics, I'd like to introduce John Wagner, who I am thankful every day he's answered the call to serve as our Chief Operating Officer for HSHS Wisconsin. So John?
Good morning. Thank you. Thanks, Bob. And thank you all for being here today. As we know, St. Mary's is the only hospital located on Green Bay's west side. There's tremendous benefit to having a hospital in this location, not only for our community in the Green Bay area, but as well as the greater region, as Bob referred to. The convenience just off I-41 allows patients that are seeking our care as far north as the Upper Peninsula of Michigan, all the way down to Fond du Lac, to be able to have easy access to high-quality specialty care right here at this facility. In recent years, HSHS, along with our physician partner, Prevea Health, we've invested a lot in the Shawano Avenue area into a robust medical corridor. When you come off of I-41, you encounter Prevea St. Mary's Health Center, as well as the Prevea Surgery Center, and of course, HSHS St. Mary's Hospital. These are all immediately available and within close range, creating a coordinated care opportunity within this region. Together, this allows us to provide for patients to get the right care at the right place at the right time. And as Bob mentioned, with the growing population, a need for more hospital-based acute care, along with the benefits of a West Side location, we feel St. Mary's is really best positioned to serve this community need. So while we're still in the early stages of design, we wanted to share with you a conceptual look at what we envision St. Mary's to look like in the next 3 years. While key services such as 24/7 emergency care are going to remain at St. Mary's, as you can see here, our vision is really to dramatically change and transform into a facility that meets the needs of the healthcare needs of the future. We're taking a very mindful approach as the design plans to ensure that we're creating a more spacious, more welcoming environment that helps promote healing at the highest level and enhances the experience for all of the folks that come through our doors. For example, one of our goals is to make navigating our campus as easy as possible. So we envision a much more prominent and clearly marked entryways, more parking spaces, and as this rendering shows, from Shawano Avenue, what it looks like as you approach the hospital. We also want our patients, visitors, colleagues, medical staff, all to feel a sense of calm when they come into our facility. Studies have shown that exposure to natural light helps contribute to healing and prevent stress. So our plans include incorporating as much natural light into patient, visitor, and colleague areas as possible. To increase patient access, we're also going to need more space, better workflow, and procedural areas. So with all of this, we envision a new medical tower on campus, and that will allow us to add more intermediate and intensive care beds so that we can care for more patients. There are also plans for more procedural and operating rooms, plus wider corridors and larger, more functional workspaces that will help our colleagues and medical professionals provide the best care and service possible to our patients. Again, while we're still in the early design phases, what you have seen and heard today is what we envision for the future here at St. Mary's and what we feel will best serve the community's need for greater access to care, not only on the west side of Green Bay, but also a new modern facility for the greater region that will help promote healing and hope at the highest level. As Bob mentioned, we're excited to get this project started as soon as possible. Our plan is to begin construction this summer, and we expect that this entire project will take approximately 3 years to complete. We also wanted to make sure that our community and our patients know what we're committed to in terms of taking a mindful approach as we move forward with the construction project. Plans are in place to ensure that patient care will not be interrupted during construction. Our patients can expect the same high quality and compassionate care that they receive today amid the construction process. We plan to use local contractors as much as possible. That way we can keep those dollars in the community. We recently hired C.D. Smith as our general contractor for the project. They're local to Wisconsin and they're headquartered in Fond du Lac. We've also enlisted HGA architect and engineers that are based out of Milwaukee. And we use Ancura for other consultative services related to design and operational efficiencies. We're committed to providing construction that is environmentally friendly and green practices during construction. We know that our founding sisters had a great reverence for the earth, and those values are deeply instilled in us as we embark on this major project. It's also important to us that we remain good corporate citizens and neighbors throughout the project. We will be and have been working closely with the city each step of the way, following all city ordinances. We'll only be allowing construction during normal business hours and being mindful about construction traffic in terms of deliveries and road traffic. We also want to ensure that our communities remain informed throughout this exciting project. So St. Mary's has established a page and a website for this very purpose. The site is now live, and you can scan the QR code here, and it will take you to a summary page for the project. And as new updates become available, this will be a source to find that. As we grow, we know that we're going to need more clinicians and staff to care for these patients. So part of this is an opportunity to visit our career site and see what positions are available for folks that maybe want to be a part of our organization while we embark on this journey. So as a reminder, our focus today is sharing our vision for St. Mary's. And as Bob mentioned, we also have plans to enhance St. Vincent campus across town. St. Vincent's is the home to our level 2 trauma, our women and infant care, and our children's hospital. And we are still assessing how we can best enhance the public and clinical spaces on that campus. And we'll be excited to share those updates when we get more details in the future. The news of our growth is being embraced by many, including our colleagues, community leaders. And at this time, I'd like to invite Dennis Langenberg, Chair of the HSHS St. Vincent's and St. Mary's Board of Directors, to share a few words. Dennis?
Thank you, John. I have the honor of serving on the St. Vincent's and St. Mary's Board of Directors for the last 9 years. I've been serving the last 4 as the board chair. There are 11 of us on the board of directors. Some of us are community members and leaders. Some are physicians, and some are former colleagues of HSHS. We all bring different backgrounds, and we bring our unique perspectives and expertise to the table. But most importantly, our presence ensures there's a community voice at the table, and that decisions are being made in the best interest of the community and based on community need. Many of our board members are here today, and I would like to take this moment to thank each of them for their service and to express to you all of our shared excitement about the future of St. Mary's and St. Vincent's. I also stand up here today as a patient and someone who can attest to the incredible care St. Vincent's and St. Mary's provides. My journey as a patient with HSHS started the moment my life began when I was born at St. Mary's sister hospital, St. Vincent's, 67 years ago on December 10th, 1957. And no, you don't have to send me a birthday card. And today, my life can continue thanks to, once again, HSHS and my doctors. Just 6 weeks ago, I underwent a life-saving double bypass surgery. I am grateful every day that my primary care doctor had the instinct to test me further when I complained of cold feet at my annual physical. It led to the discovery of blockages in the heart, and I'm also grateful for the incredibly skilled and compassionate care that I received during that time. The care you receive at HSHS is body, mind, and spirit, and the compassion shown by the nurses, physicians, and everyone along the patient care journey is unmatched. My wife also experienced that compassionate care 10 years ago when she was on ICU, and also when she just had a knee surgery done here at St. Mary's. And this photo right here shows me and my youngest granddaughter, Margot, in the NICU at St. Vincent's. Margot was born prematurely, but is strong and healthy today, thanks to the expert and compassionate care she received with HSHS. St. Vincent's and St. Mary's have cared for generations of families, like mine, for more than a century. It would be hard to find a single person in this room who has not received care or who doesn't know somebody that received care by our hospitals. These hospitals are part of the very fabric of the community, and with these investments and plans to expand and modernize, they will be able to care for many more generations. And St. Mary's Board We couldn't be more excited for the hospitals in our community who will benefit in the end. I thank you.
Thank you, Dennis. Just a couple closing remarks, and then we can open up for questions. And thank you again to all of you who have joined us here today to share this news as we begin this journey of transforming our facilities, but beyond that, really transforming how we do healthcare together in this community to do the absolute best we can for each and every one of you that trusts us with their care. Today's announcement really, to me, powerfully reaffirms our commitment made to Green Bay. More than a century ago, with the arrival of our founding sisters, to care for this community with compassion and excellence. And I sit here fairly humbly before you, knowing that we stand on their shoulders. Our founding sisters established the city's first hospital, St. Vincent, in 1888, and this year, St. Mary's incredibly celebrates its 125th year anniversary. And our message to you today is, as we're growing, our aim is to be here for another 125 years. And that's what we're setting up to do, because the mission is so important to our community and to those that came before us. We're really proud of the care we give throughout northeastern Wisconsin. So not only in Green Bay, but we have ministries in Oconto Falls and Sheboygan, partnerships in Door County, partnerships with our Prevea partners for the clinic footprint, our oncology partners. And the goal of all that is we want to keep care close to home as much as possible. There's times it just can't, that people need a higher level of care. So we're investing out throughout this part of the state so people can have access to care, stay close to home, stay close to loved ones, but have a great seamless transition when you need a higher level of care, whether it's heart attack or stroke or trauma or a NICU baby. That's our mission, is personalized care for each and every member of our communities, no matter how big or no matter how small. We're also very fortunate to be part of a system that has ministries throughout Southern Illinois, Central Illinois, and Wisconsin that all share that same mission and all share the same vision that through our mission, our strength, and our growth, we're going to deliver on our promise that the sisters started so many years ago to care for the whole person each and every day. And in a time when healthcare in much of the world is changing by the second, we are here for the long haul. And we're going to continue to discern to make the right decisions that we can always nourish and provide this ministry for all of you. So again, I can't help but think of our sisters standing here today, and we're really here at this point. It's an inflection point because of all the good that has come before, all the great work. I see some of our former administrators, some of our former employees, people that have been here for that 125 years. We're here because we have such good roots. I kind of think of it as now it's time to sprout wings, and that's what we're going to do. So really excited to share this with you. I'd conclude with just a message of gratitude to all the communities that through the years and going forward have trusted us at your most vulnerable time, trusted us with your care, the care of your loved ones, and that is why we are making this investment. So thank you all for being here today, and with that, we will open it up to questions. Yes.
So, you mentioned this is a $470 million investment, but, it comes about a year after HSHS closed Western Wisconsin hospitals and clinics. I guess, how do you kind of square that?
How do you balance it?
Just discontinued services in the western part of the state, we're putting a bunch of money in a part of the state with lots of hospitals already.
Right. Yeah, thank you. Thanks for that question. So one thing I'm proud about our system is when we make decisions, we really do go through a discernment process. And each market's a little bit different and has different market circumstances and nuances and economic realities. And so this decision didn't come at the expense of that one. They're very unique, very different. We're here because, we are the market leader. We're growing. The need is expanding. And so we feel we really need to respond to that need. But I appreciate the question, but each market's a little bit different. And I think throughout healthcare, throughout the states, people are looking at those where you have to really focus on what's driving the realities of each market, then how can you meet the need, and what would justify that? And so this investment is so critically important as we just continue to see this trend of growth here. So thanks for the question.
What is the bed capacity here now, and what do you anticipate becoming with this expansion?
Yeah, thank you. So at St. Mary's, we run a census when we're busy, about 60 to 65 patients. The bed tower right now is planned will be a little over 100 beds, but the biggest increase will be in ICU beds and critical care. So mention about sick patients coming in. Right now at St. Mary's, we have 8 ICU beds. In the new tower, we anticipate 36. So you can kind of see that shift to a sicker population. And then also, you know, our sister hospital, St. Vincent's, is 5 miles away, and we'll continue to renovate and use those beds as we continue to do. So a lot of care continues to move to outpatient. But what we see in our hospitals, no matter what hospital you're in, is it's really sick people. And so we need to increase and enhance our ability for those high acuity patients.
That nurses that care for those patients are more highly skilled. I know there's a little bit of talk about staffing.
Yeah.
Repeatedly do stories about nursing shortages. How are you going to staff?
Yeah, that is a great question. So especially with more ICU beds needs more ICU trained nurses, more respiratory therapists, more intensivists, really more of everything as we go. And so this is a 3-year construction plan. That seems like a long time. It's not. And so recruitment starts today. Both retention, recruitment, investing in our workforce. We'd like to come up with, and we continue to work on ways of kind of growing our own talent, collaborating with universities, technical colleges, to really start to get people early into the workforce. So, you know, right now we're seeing such growth. We continue to recruit, but we can't wait until it's 6 months to opening to make sure we're fully staffed for what we do. So that's going to be a huge component of this. Probably the biggest component is the staffing component as we go forward. So to that, I would like to think a really nice new environment is going to help, right? Because we're going to design it and process it in a way that, you know, maximizes our effectiveness, efficiency, and as John said, a really healing environment. So that's why we've got the kind of website for recruitment right up with the building, so we can kind of tie those together.
Will those frontline workers be involved in the design process? Because
Yeah.
they're going to be working. So it's easiest for them.
Another great question. We're trying to push the decisions for how the designs are closest to the people doing the work. And so early design is underway, and we've got work groups, whether it's service line, nurses, our food service workers, whatever that might look like, is now's the time we start really getting more direct feedback from those that will be doing the work. Other questions? Yeah, so great question was, are there new services? We continue to evolve our services as we go. It's probably more enhancing and increasing. So again, as we see higher levels of care coming in from communities from the Upper Peninsula to Door County to Fond du Lac to everywhere in between, they're coming here because they need a higher level of care. And so those areas are evolving too. Technology is changing. So cardiac care looks different today than it did, you know, even 5 years ago. So we have to invest in the facilities that can handle those type of procedural areas. Robotics is a big part of it, which is actually really cool. And so then we look at, between the two facilities, how do we optimize those services so we're not duplicating, right, with like staffing. We want highly trained experts focused on those higher levels of care. So I wouldn't say adding new services as much as enhancing and optimizing the great services we have in this community. Okay. Again, thank you. Thank you for being here. Thank you for your support. We look forward to your feedback and dialogue as we continue on this journey. And just very, very appreciative for all your time, your support, and being here today. Thank you.